坚决防止简单化、一刀切、层层加码，最大限度减少对群众生产生活的影响。要继续推进新冠病毒疫苗接种工作。截至12月17日，全国累计报告接种新冠病毒疫苗26亿6183.8万剂次，完成全程接种的人数为11亿8628.9万人。今天发布会的主题是科学精准做好疫情防控。
Ladies and gentlemen, welcome to today's press briefing of the State Council. The topic of today is to make a good work in the prevention and control of COVID-19. Today, we are very honored to be joined by many VIPs of the State Council Department, including Director General Liang Wannian and Director General He Qinghua and Director General Wu Shiping. And also the Director General Liang. They are from different departments of the State Council, including the National Health Commission and also the State Aviation Administration of China. And later, this floor is open for questions. Please identify yourself before you raise the question. Now, the first question. I'm from China Media Group. Right now in China, we'd like to know about the latest situation of the COVID-19 case in China and what's the features of the containment measures in China. Well, the Director General He will answer your question. Well, thank you for your question. The COVID-19 situation in China maintained a steady progress. And in most of the places in China, the COVID-19 has been put under effective control, except in some regions like in Yunnan province, in Heilongjiang province. And in Heilongjiang, there has been no new added cases in consecutively 4 days in the region. And in other regions, the containment measures have ended the cases. And in some regions, some cases came from the isolated regions, but mostly are the scattered cases. So these cases emerge mostly in the key areas for prevention and control. In Shanxi province, in Guangdong province, the COVID-19 cases came from the same region and came from the same spread chain of the variant. And the situation continued to develop and has the trend to further spread to other parts of China. But we are working closely in the region for the containment measures. At the moment, there are some scattered cases in China, especially in the ports, in the border areas. And these are the key regions for the spread of the virus. And mostly cases are coming from the imported cases from the rest of the world. So the State Council Joint Prevention Control Mechanism sent special working teams composed of experts to guide the local containment measures in the regions. And we will further promote nucleic acid tests and the isolation of the communities. And we will inspect the local areas to make sure the containment measures are fully implemented to contain the spread of the virus. Thank you. The second question. Thank you for this opportunity. I'm with Macau Daily. I have a question. Right now, there has been some local cases in Guangdong province. As the New Year is around the corner and the Chinese New Year is also around the corner, what kind of containment measures are you going to take to protect the local people, especially in the high traffic season? And how will you do to improve the service quality? So what will be the measures? Thank you. This question goes to Director General Han Guangzu. Thank you for your interest and raising this question. There has been some scattered cases lately in China. During the peak season, as we are close to the Chinese New Year and the New Year. So the National Aviation Administration of China closely watched the development of the COVID-19 cases in China, and we will ask people to show the health code. And we asked the companies, the air companies, to disinfect the interior part of the plane to put into place the effective health measures and to remind the passengers to wear facial masks and avoid gatherings. And also we strengthen the ventilations in order to protect the safety of the passengers. And we put this as a priority of our aviation work. We will continue to strengthen the containment measures in the key regions. First, we will work together with the distant passengers and to check their health codes. And second, we will divide passengers into different sections and ask them to stay in the restrooms and avoid walking around. So we will put in place the closed chain management of the passengers and the spaces. We have put in place 391 we have suspended 391 times of flights, and we have cut 339 flight routes in order to protect the safety of the passengers. And we strengthened coordination of the flights and asked people to work overtime whenever needed in order to serve the passengers, and we responded quickly to the needs of the passengers. We asked the local authorities in aviation departments to improve the service quality and also the transportation capacity in order to carry out the air service. We asked the civil aviation departments and air flight companies to work on the duty shifts and to improve the service quality. We also opened a customer service line to the people. As the Chinese New Year and is around the corner, we kindly remind our people to watch closely the regulations and the rules of the destinations and to take the nucleic acid tests whenever needed, and also to show the green health code and when getting on board to cope with the containment measures. Thank you. The floor is open for more questions. Many thanks. I'm from People's Daily. The National Health Commission of China said China is at a special period for the dynamic zero-case period. So can you explain, further explain? Well, Director General Liang will answer your question. Well, China has entered such a dynamic process since last year, and this is a period when China reduces the cases and effectively contained scattered cases. And we try to contain the COVID-19 cases within the longest incubation period. So we put in place the comprehensive containment measures to contain the imported cases and also to prevent the rebounding of the domestic cases. So when clearing the COVID-19 cases in China, we take a holistic approach. So whenever there is a case, we quickly eradicate the case. We do this to prevent the case from further developing in China. So we tried to contain the cases at the lowest costs in China. This is what China has done for containing the cases, and also this is China's best choice. So taking a comprehensive approach means we need to watch three aspects and two areas. First, we need to contain the imported cases. We take a targeted approach for monitoring the distant cases. So we also contained the cases that stays on the surface of objects, and we must be highly sensitive to the cases. And third, we strengthen the nucleic acid testing, especially in the targeted groups of passengers. Fourth, we strengthen the monitoring of the variants of the COVID-19 cases. And we also strengthened the containment of the transmission routes of the virus, especially the routes from people to objects. We take targeted measures to contain the transmission routes. For example, we classified the transmission routes as high-risk areas, and middle-risk areas, and low-risk areas. We take different targeted measures towards the different classified regions. This means we are taking targeted measures against different levels of risks. Since over the past 2 years, we classified these regions from 2 levels to 4 levels. That means there is regions. We divide the regions by the municipality level, by the county level. But now it's further divided into community level and even neighborhood level. We do this to cut the transmission routes of the virus and to make the containment measures more effective and efficient. And regarding the containment of the easily transmitted people, we strengthened efforts on the R&D efforts on developing the new medicines and new treatments. And we also carried out health campaigns across China, especially in strengthening the capacity of the community level. We also strengthened publicity efforts to improve the awareness of our people on the COVID-19 virus. We carry out trainings towards the people to improve our people's ability to protect themselves. And there is a scientific meaning about the centralized containment. And first is to carry out targeted, precise epidemiological research. We harness the big data and relevant technologies to assist the identification of the transmission scope of the virus, the classification of the infected areas. Secondly, we take a precise monitoring of the disease and also the testing of the COVID-19. Third, we precisely classified the infected areas and also the infected groups. We carried out precise treatment of the infected. That means we not only watch the infected cases, but also how they feel about themselves at a psychological level. So the nuclear testing has been carried out among the people to make sure each one received the nuclear acid tests at least once. Many thanks. Another question from the floor. From the financial program center of the China Media Group, during the new Chinese New Year period, there will be a peak season for the traffic and the vehicles. What measures will you take to cope with this phenomenon? Many thanks for your question. The Director General Shi Ping from the National Railway Group, the Health Department. Well, during the Chinese New Year for 2022, there will be a peak season for the people and the vehicles. Compared with 2021, there will be a big increase in the number of passengers. This will pose a great challenge to the traffic control. The railway departments in China will coordinate the traffic during the Chinese New Year period. We will take precise measures to cope with the containment measures to make sure that the virus does not transmit through the railway network and the people enjoy safety protection service. First, we strengthened capacity of traffic. We opened new traffic lines, especially the more high-speed rails. In 2022, the railway capacity will increase by 10% against 2019. The tickets to be sold will be contained at a given level. We will sell the tickets at different channels and to make sure that the traffic capacity met the expectations of the people. We will also make sure that the railway stations implement the responsibility of containing the COVID-19 at the local level, and they will check the health codes of the passengers. If the passengers do not meet the requirements, they will not be allowed on board. We will make sure that the passengers will enter the train stations in an orderly manner, and we will reduce the contacts between the passengers in order to cut the transmission route of the virus. We will deliver the food to the passengers' seats instead of letting them dine together. We will strengthen ventilation and disinfection within the trains and the train stations. We will also we respond to the emergent needs of the passengers. We will make contingency plans for the passengers. There will be contingency seats reserved for the passengers, and also contingency products released for the passengers, so that we will respond quickly to the emergencies. We will ask the local train stations to cope with the train staff on board. Once there is an emergency, we will act quickly. All in all, we will coordinate the traffic efforts with the containment measures of the COVID-19 in order to serve our people in the traffic peak.
新华社记者提问，还有2周就到元旦假期了，许多人都关心假期能不能回家团聚的问题。
And with Xinhua News Agency, there are only 2 weeks away from the Chinese New Year. Many people ask whether they can travel during the period back to their hometown. We noticed there has been some documents about this traffic season. Can you answer this question? Can you let us know whether we can travel or not? Well, thank you for your question. And there are 2 weeks away from the New Year, and the Chinese New Year is also around the corner. Of course, there will be people traveling around. The question is how we will guard against the potential risks of spread of the COVID-19 cases. So there is a triangular relationship between the traffic and the people and the COVID-19 epidemic. We must know something about the morbidity, the fatality rate of the COVID-19. Secondly, we must be aware of the health system in China. We must be confident in the capacity of the health system in responding to the emergencies. Another point is how is the situation in China's health network. This requires the synergy of the government, the people, and the relevant departments. During the Chinese New Year, there will be people moving around. This means there will be risks for the spread of the virus. So we need to study the situation and make some predictions. I think there are a few factors that we need to consider. First, there will be risks for people traveling around during the New Year, and there will be people gathering together, and the social distancing is narrowing down. This will favor the spread of the disease. And the winter season is a peak period for the spread of the virus and the increasement of the cases. And people's capacity of guarding against the virus will decrease in winter. We must be aware of this situation. But people's immunity against the disease, speaking of this point, we have been well prepared. First, China's vaccinations have amounted to 260 million doses. That means we have gained a certain level of herd immunity. Most of the recent cases are related to the imported cases. That means there are few domestic cases in China. So basically, China is quite safe at home. So the major risk comes from outside China. Judging from the experience of China's containment of the disease across the past 2 years, our people have maintained good habits. For example, we wear facial masks, we wash hands very often. This has become a daily habit of the people. And it's very encouraging to see this phenomenon. Just now, you have heard from my colleagues the efforts we have made in the traffic sector. That means we are quite prepared for the spread of the epidemic during the Chinese New Year. So, whether we will be facing risks of the spread of the disease, I think we need to take a targeted approach towards this situation. In some key regions and the key groups of people, we must take some precise containment measures. We cannot change the current policies even during the Chinese New Year period. For some elderly and pregnant women who have the chronic disease, they need to reduce their outdoor activities and their traveling. For other people who want to travel around, we need to improve their awareness on the containment measures and fully implement the guidelines from the government, and they need to be responsible for themselves. As you know, China is a large country. We have many different regions, so we cannot take a holistic rule towards all regions. There can be regions, the border areas. As you know, the Winter Olympics is around the corner. For these regions, they must adopt strict containment policies. But for other parts of China, we need to carry out a strict evaluation of the situation and then take targeted and reasonable and humanistic and human-centric containment measures. So we need to precisely balance the needs of traveling during the Chinese New Year and also the needs for containment measures. This is a challenge and testing of the governance capacity of the local governments. In order to complete this target, the local governments need to work very hard and take into consideration the risks of imported cases and also exported cases. We need to closely evaluate the risks of the people who are prone to be infected. We also need to disseminate some documents and brochures to our people for traveling around during the Chinese New Year period. With the new economic daily, now China is taking strict containment measures. There has been some imported cases in different parts of China. So at a community level, what measures will you take in order to protect the safety of the communities? Many thanks for your question. Well, over the past 2 years, China has done a lot in preventing and containing the COVID-19 cases. And we have improved our capacity in managing the case in different regions and among different groups. The World Health Organization staff have joined the local communities in helping the people guarding against the COVID-19 epidemic. So this has improved the synergy of our people and the government, and we have also improved our documents and guidelines. And this has provided an evidence-based approach for our containment measures. Our community health service centers have played an important role in many aspects. First, we have provided treatment to the people. We checked their health codes, and we have built the fever clinic points and put in place the isolation points for the communities so that the responsibility will be taken in the first place. Second, We strengthened the management of the community-level health service. We sampled the people who have been affected, and we carried out daily monitoring of the people, and we visited the people door to door. For the mid to high level regions, when people coming from these regions, we will put them into records and monitor the process and ask them to take the nucleic tests. And we also make contingency plans and working teams. We have developed a nucleic acid testing contingency plan, and we also carry out maneuvers of these campaigns. We also asked the medical pharmacies to improve their supplies. For example, the medicines to stop cough and the fevers. So we carry out the health monitoring of the local people and move them to the fever departments of the hospitals whenever necessary. Thanks from the Phoenix TV. As the New Year and the Chinese New Year are around the corner, what do you think we need to consider when moving around the country? Well, the Chinese New Year and also the New Year are around the corner, and also a couple of important events like the Winter Olympics are going to be held in Beijing. However, the COVID-19 situation in China is still very severe, and the Omicron variant has been transmitting in 77 countries around the world. This has posed a great challenge to the containment of the cases. We must be highly aware of the situation, and based on our past experiences, we must take precise and targeted measures to improve the safety of our people and to ensure that the people go to hometown for the family gatherings in a safety manner. We kindly remind our people to improve their safety control measures and to wear facial masks and wash hands and to develop good personal habits and to also to get vaccinated. Secondly, for people coming from the mid to high risk areas, including the counties, the cities, we must ask the local regions to carry out nucleic acid testing across these people and to follow the epidemiological process of the region. The the local prevention control mechanism must provide a 48-hour nucleic acid testing result and follow the relevant rules and regulations. For the local counties, municipalities, districts, and prefectures of the mid to high level risk areas, they should not be allowed to travel around. But other regions at the mid to high level risk areas should not travel if it is not necessary. But for the prefectures, the counties, the cities in these high-risk areas, they should not travel. If there is no risk, if there is no need to travel, you should not go visit these places in the mid to high-level regions. If the symptoms of coughs and fever are detected among the people, they need to show their health code to the community, and they should not be allowed to visit other places before they prove they are safe. From China's Central News Agency, the State Council issued a new document, a notice on the prevention and control of the cases. The notice said that different regions in China can set up buffer zones for the containment of the COVID-19 cases. So could you further explain what is the buffer zone and how that will help us improve the containment of the cases? Director General Liang will answer your question. Thank you for the question. The State Council issued the notice of strengthening the containment at the ports and borders. To my understanding, it is part of the precise containment. It is a positive exploration of the containment measures. That is to take the ports and the border areas as part of our whole regions to consider the population, the epidemic, and so to develop a buffer zone in these regions. That means we also have a non-buffer zone. That means we take a section-by-section approach to contain and balance the containment of the disease and also the development of the economy. In China's border areas, including the land ports, for example, some most remote areas, these can be considered as the buffer zones, but we will take very strict containment measures. We will set up exit points at these ports. So people will ask to leave these regions. If there is no confirmed case in the buffer zone, then this region can restore their daily life and their normal measures. But once there is a case detected in the buffer zones, we must take even stricter containment measures. That means we will further divide the buffer zone into 3 different parts or regions. That means we will impose a differentiated treatment of the buffer zone. And that means we are taking precise measures to divide the people into close contacts and sub-close contacts. I also mentioned the non-buffer zones. So in these areas, we will impose the normal containment measures. That means the people will enjoy the normal daily life. But we will step up efforts for managing the situation. So the setup of the buffer zone needs the local governments to attend to the local features and to take an evidence-based approach. So that is up to the local governments to decide the scope of the buffer zones. So as far as I'm concerned, I think this will help improve the safety of the local region. And that means we are setting up 2 protection lines in the buffer zones, while in the past we only have 1 protection line. Let me give you an example. If a border city has only 1 protection line, but if there is a confirmed case, if there is an imported case, how can we ensure that this case do not spill over to other parts of the city? If there is only 1 measure to protect the city, then it will be risky. But if we set up 2 protection lines in the buffer zone, then we can prevent the spillover of the confirmed cases. The setting up of the buffer zone can help reduce the social costs while containing the COVID-19 epidemic.
谢谢主持人。封面新闻记者提问：我们了解到，老年群体在疫苗接种过程中会有一些不方便的情况，有的接种信息渠道有限。
Many thanks from the front cover news. We learned that many elderly has little access to the vaccination in China. For example, many people who are disabled and they are not convenient to move around. So for these elderly people, what kind of measures have we taken to improve the service? Many thanks for your question. For the elderly who feel inconvenient to receive the vaccinations, we have taken a couple of measures to improve the service quality. First, we put in place the family doctors, and so that the elderly people can enjoy a good climate at the community level. And we have posted up posters at the community, and we have staff to give the elderly more knowledge about the vaccinations. We also have people visiting the elderly door to door, so that vaccination can move to the communities. We also disseminate the medical packages to the elderly. For the elderly who feel hard to move around, we have set up special vaccination points at the communities. For those people who feel difficult to make reservations, we have set up green channels for the elderly. That means they enjoy the green lights for receiving the vaccination. We also have people to explain the relevant policies to the elderly to respond more effectively to the elderly. And for the elderly who have no family members to accompany them to the community health centers, we will give the vaccination at the weekend.
21世纪经济报道记者提问，想请问一下，在2节期间，高风险岗位的从业人员出行是否会受到限制？
I'm from the 21st Central Economic Daily. During the New Year and the Chinese New Year, will the travel of the high-risk people who hold high-risk positions be restricted? Well, thank you for your question. The people who lead a high-risk position will be prone to higher risks of being exposed to the harmful products and harmful places. So we have seen these cases in, for example, the transportation sector. These have led to the further spread of the COVID-19 cases. So there has been more risks in the transportation, in the air traffic sectors, and also the food processing sector. For these people, we will take strict containment measures and impose closed links management and also take nucleic acid testing across these people. We will also provide more trainings to these people. And during the Chinese New Year and also the New Year, we will kindly ask these people to avoid traveling around. This is necessary to ensure the safety of our people. If they have to travel, they must meet 3 requirements. First, they must leave these posts and positions. Second, they must take nucleic acid testing, and the result must show negative. And third, they must show the green health code. They must cope with the local containment measures of the destinations. Of course, we are facing very high pressure during these positions. We will give more care and love to the people working in the high-risk areas. Thank you. The floor is open for more questions. I'm from Hong Kong, China Review Daily. When there is an outbreak of the COVID-19 case, how can we coordinate the containment measures and also the development of people's life? Director General Liang will answer your question. Well, thank you for your question. Containment of the COVID-19 at the ports require us to take reasonable measures and also to care about the economy of the local region. I think there are a few aspects that we can do together to coordinate the containment of the cases and also the well-being of our people. First, we must take precise containment measures. We must make it a routine for checking and registration of the people visiting the region. That means we must make contingency plans and for the closed link management. For people arriving at the ports, we must report the case and also develop the epidemiological research result within 24 hours. We must monitor the situation in a timely manner. We must contain the number of people being infected, and we also need to make reasonable policies. We must identify the risks of the infected cases, and we must protect the privacy of the confirmed cases, and we must respond to the needs of our people, and we must ensure that the basic needs for food and water from our people are met. We also need to respond to the needs of our people in a timely manner. We must take regular inspections to make sure that supplies is in place so that our people's needs will be met. First, we will strengthen the publicity efforts to improve the public awareness on the nucleic acid testing and the time and location for the tests, and also the laws and regulations of relevant policies. We will improve the frequencies of our publicity efforts and adjust our ways of publicity efforts so as to boost the understanding of our people on the epidemic control.
谢谢发言人。香港经济导报记者提问，我的问题提问给武世平先生，请问铁路部门春节期间如何加强货运防控，特别是加强
Thank you from Hong Kong Economic Guide Daily. During the New Year and Chinese New Year, what measures will you take to strengthen the control of the freight transport and also the imported freight? Thank you for your question. According to our internal policy of containing the imported cases and also domestic cases, we will fully implement the policies to ensure that each link of the freight transport will be closely watched. For the workplaces, the equipments, the tools, the vehicles, we will carry out large-scale disinfection, and we will provide the disinfection note across these places. We will strengthen the containment measures at the ports. So there will be monitoring, disinfection, and testing of the imported products. We will separate the imported products from the domestic products, and we will separate the imported people from the domestic people. We will also separate the facilities that is coming from outside China and also from inside China. We will impose high-frequency nucleic acid testing. So we will take a comprehensive approach for containing the epidemic. We will fully harness the railway transportation information network, and we will harness the hotline 95306 to provide service to our people in order to decrease the risk of transmission of the virus. From the South China Metropolitan Daily, so how will the community respond to the pressure of vaccination in China? Director General Li will answer your question. In the Chaoyang district of Beijing municipality, at our local health service center, the normal vaccination people are separated from the special groups of people. The special vaccination, the COVID-19 vaccination place is different from the ordinary vaccination places. We will try to reduce the people who accompany the recipients of the vaccinations. The vaccination work is being put in place in an orderly manner. For the as the vaccination of COVID-19 involves a large number of people, so we have coordinated and dispatched a large number of people to help with the vaccination. We also asked the people from the children's hospitals and also the psychological disease hospitals to help with the vaccination efforts. Well, the VIPs of today's press briefing has given you the latest information of containment measures of COVID-19 in China. We will give you further updates on the situation later on. Thank you for watching.